Hello, and welcome to the COVID-19, otherwise known as coronavirus, guidance on preparing workplaces for COVID-19, set forth by the OSHA publication 3990-03-2020. In the guidance, there are many areas where they talk about COVID-19 or the SARS-CoV-2. Both of these we will reference as the coronavirus for simplicity's sake. The guidance discusses about COVID-19 or the coronavirus, how a coronavirus outbreak could affect workplaces, steps all employers can take to reduce workers' risk of exposure, classifying worker exposure, jobs classified at lower exposure risk, which should use caution, what to do to protect those workers, jobs classified at medium exposure risk, and jobs classified at high or very high exposure risk. So what are the symptoms of coronavirus? Symptoms typically include fever, cough, and shortness of breath. Some people infected with the virus have reported experiencing other non-respiratory symptoms. Other people, referred to as asymptomatic cases, have experienced no symptoms at all. According to the CDC, symptoms of coronavirus may appear in as few as 2 days or as long as 14 days after exposure. So how does this virus spread? The virus is thought to spread mainly from person to person, including between people who are in close contact with one another within about 6 feet. They have recommended maybe 8 feet now to create a barrier, an air barrier within that 6 feet, so to give you a 2-foot air barrier. Also through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. So how will the coronavirus affect our workplaces? Absenteeism. Workers could be absent because they are sick, are caregivers for sick family members, are caregivers for children if schools or daycare centers are closed, have at-risk people at home, such as immunocompromised family members, or are afraid to come to work because of fear of possible exposure. Another way that the outbreak could affect workplaces is the change in patterns of commerce. There will be challenges on supply and demand. Consumer demand for items related to infection prevention, like respirators, we're finding this a huge challenge in our construction industries, is likely to increase significantly, while consumer interest in other goods may decline. Consumers may also change shopping patterns because of the coronavirus outbreak. Consumers may try to shop at off-peak hours to reduce contact with other people, show increased interest in home delivery services, or prefer other options, such as drive-through service to reduce person-to-person contact. And the other concern that the outbreak could affect workplaces is the interrupted of supply and delivery chain. Shipments of items from geographic areas severely affected by COVID-19 may be delayed or canceled with or without notification. So what are the steps all employers can take to reduce workers' risk of exposure to the coronavirus? Develop an infectious disease preparedness and response plan. Where, how, and what sources of coronavirus might workers be exposed, including, is it the general public? Are they customers, co-workers, and sick individuals, or those at particularly high risk of infection, international travelers who have visited locations with widespread, sustained, ongoing coronavirus transmission, healthcare workers who have had unprotected exposures to people known to have or suspected of having the coronavirus. There are also non-occupational risk factors at home and in community settings. Workers' individual risk factors. Older age, presence of chronic medical conditions, including the immunocompromising conditions, pregnancy, controls necessary to address these risks. The one thing for sure that we need to do is follow the federal and state, local, tribal, and territorial recommendations regarding development of contingency plans for situations that may arise as a result of outbreaks, such as increased rates of worker absenteeism, the need for social distancing, staggered work shifts, downsizing operations, delivering services remotely, and other exposure-reducing measures. What are the options for conducting essential operations with a reduced workforce, including cross-training workers across different jobs in order to continue operations or deliver surge services, interrupted supply chains or delayed deliveries. Plans should also consider and address the other steps that employers can take to reduce the risk of worker exposure to the coronavirus in their workplace, described in the next section. To reduce worker exposure, we can promote frequent and thorough hand washing, including by providing workers, customers, and worksite visitors with a place to wash their hands. If soap and running water are not immediately available, provide alcohol-based hand rubs containing at least 60% alcohol. If you have the Purell is rated at a 70% alcohol. Just check the back label to make sure that it is at least 60% alcohol-based. Encourage workers to stay home if they are sick. Encourage respiratory etiquette, including covering coughs and sneezes. Provide your customers and the public with tissues and trash receptacles. Employers should explore whether they can establish policies and practices such as flexible work sites, telecommuting, and flexible work hours, staggered shifts, to increase the physical distance among employees and between employees and others if state and local health authorities recommend the use of a social distancing strategy. Discourage workers from using other workers' phones, desks, offices, or other work tools and equipment when possible. Maintain regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment. When choosing cleaning chemicals, employers should consult information on the EPA-approved disinfectant labels with claims against emerging viral pathogens. Products with EPA-approved emerging viral pathogens claims are expected to be effective against coronavirus based on data for harder-to-kill viruses. Follow the manufacturer's instructions for use of all cleaning and disinfection products. What's the concentration, the application method, and contact time, and what type of PPE to use? The development of policies and procedures for prompt identification and isolation of sick people, if appropriate. Prompt identification and isolation of potentially infectious individuals is a critical step in protecting workers, customers, visitors, and others at a work site. Employers should inform and encourage employees to self-monitor for signs and symptoms of the coronavirus if they suspect possible exposure. Employers should develop policies and procedures for employees to report when they are sick or experiencing symptoms of the coronavirus. Where it is appropriate, employers should develop policies and procedures for immediately isolating people who have signs and/or symptoms of the coronavirus and train workers to implement them. Move potentially infectious people to a location away from workers, customers, and other visitors. Although most work sites do not have specific isolation rooms, designated areas with closable doors may serve as isolation rooms until potentially sick people can be removed from the work site. Take the steps to limit spread of the respiratory secretions of a person who may have the coronavirus. Provide a face mask if feasible and available, and ask the person to wear it if tolerated. Note, a face mask, also called a surgical mask, procedure mask, or other similar terms, on a patient or other sick person should not be confused with PPE for a worker. The mask acts to contain potentially infectious respiratory secretions at the source, therefore the person's nose and mouth. If possible, isolate people suspected of having the coronavirus separately from those with confirmed cases of the virus to prevent further transmission, particularly in work sites where medical screening, triage, or healthcare activities occur, using either permanent, wall or different room, or temporary barrier, plastic sheathing. Restrict the number of personnel entering the isolation areas. Protect workers in close contact with, therefore within 6 feet of, a sick person, or who have prolonged repeated contact with such persons by using additional engineering and administrative controls, safe work practices, and PPE. Workers whose activities involve close or prolonged repeated contact with sick people are addressed further in later sections covering workplaces classified at medium and very high or high risk exposure. What are we going to do to develop, implement, and communicate about workplace flexibilities and protections? Actively encourage sick employees to stay home. Ensure that sick leave policies are flexible and consistent with public health guidance and that employees are aware of these policies. Talk with companies that provide your business with contract or temporary employees about the importance of sick employees staying home and encourage them to develop a non-punitive leave policy. Do not require a healthcare provider's note for employees who are sick with acute respiratory illness to validate their illness or to return to work, as healthcare provider offices and medical facilities may be extremely busy and not able to provide such documentation in a timely way. Maintain flexible policies that permit employees to stay home to care for a sick family member. Employers should be aware that more employees may need to stay at home to care for sick children or other sick family members than is usual. Recognize that workers with ill family members may need to stay home to care for them. Be aware of workers' concerns about pay, leave, safety, health, and other issues that may arise during infectious disease outbreaks. Provide adequate, usable, and appropriate training, education, and informational material about business essential job functions and worker health and safety, including proper hygiene practices and the use of any workplace controls, including PPE. Informed workers who feel safe at work are less likely to be unnecessarily absent. And if possible, work with insurance companies, those providing employee health benefits, and state and local health agencies to provide information to workers and customers about medical care in the event of a coronavirus outbreak. So what safe practices can we implement? Providing resources and work environment that promotes personal hygiene. For example, provide tissues, no-touch trash cans, hand soap, alcohol-based hand rubs containing at least 60% alcohol, disinfectants, and disposable towels for workers to clean their work surfaces. Requiring regular hand washing or using of alcohol-based hand rubs. Workers should always wash hands when they are visibly soiled and after removing any PPE. Also, we can post hand washing signs in restrooms. Throughout this entire process, OSHA wants us to realize we still have to follow existing OSHA standards. OSHA's Personal Protective Equipment Standards, PPE, in general industry, which require using gloves, eye and face protection, and respiratory protection. When respirators are necessary to protect workers or where employers require respirator use, employers must implement a comprehensive respiratory protection program in accordance with the Respiratory Protection Standard. The General Duty Clause, Section 5A1 of the Occupational Safety and Health Act from 1970, which requires employers to furnish to each worker employment and a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm. The third standard that they want you to recognize is OSHA's bloodborne pathogen standard. It applies to occupational exposure to human blood and or other potentially infectious materials that typically do not include respiratory secretions that may transmit the coronavirus. However, the provisions of the standard offer a framework that may help control some sources of the virus, including exposures to body fluids that are not covered by the standard. So how do we classify our workers? The first we're going to discuss is the very high exposure risk, our healthcare workers, the ones on the front lines performing procedures on known or suspected coronavirus patients. Healthcare laboratory personnel collecting or handling specimens from known or suspected coronavirus patients. And morgue workers performing autopsies which generally involve aerosol generating procedures on the bodies of people who are known to have or suspected of having coronavirus at the time of their death. The high exposure risk category is the next category for classifying worker exposure. Workers in this category include healthcare delivery and support staff that are exposed to known or suspected coronavirus patients, medical transport workers, moving known or suspected coronavirus patients in enclosed vehicles. Some examples of these would be maybe the housekeeping staff at a hospital that have to clean the rooms and disinfect the rooms from patients. Mortuary workers involved in prepping the bodies of people who are known to have or suspected of having coronavirus at the time of their death. Workers who have medium exposure risk are those that require frequent and or close contact with, within 6 feet of, people who may be infected with the coronavirus, but who are not known or suspected coronavirus patients. In areas without ongoing community transmission, workers in this group may have frequent contact with travelers who may return from international locations with widespread coronavirus transmission. This would be such as an airport worker. In areas where there is ongoing community transmission, workers in this category may have contact with the general public in schools, high population density, work environments, and some high-volume retail settings. And lastly, there's the worker that has low exposure risk. This should just use caution. Jobs that do not require contact with people known to be or suspected of being infected with the coronavirus, nor frequent close contact with, within 6 feet of, the general public. Workers in this category have minimal occupational contact with the public and other coworkers. So how can we protect workers in the low exposure risk group? When it comes to engineering controls, additional engineering controls are not recommended for workers in the lower exposure risk group. Employers should ensure that engineering controls, if any, used to protect workers from other job hazards continue to function as intended. Lower exposure risk administrative controls. Monitor public health communications about coronavirus recommendations and ensure that workers have access to that information. Frequently check the CDC coronavirus website. Collaborate with workers to designate effective means of communicating important coronavirus information. And when it comes to PPE for lower exposure risk workers, additional PPE is not recommended for workers in the lower exposure risk group. Workers should continue to use the PPE, if any, that they would ordinarily use for other job tasks. When it comes to protecting the worker with a medium exposure risk, the engineering controls are install physical barriers such as a clear plastic sneeze guard where feasible. Administrative controls. Consider offering face masks to ill employees and customers to contain respiratory secretions until they are able to leave the workplace. Therefore, such as medical evaluation, care, or to return home. In the event of a shortage of masks, a reusable face shield that can be decontaminated may be an acceptable method of protecting against droplet transmission. Other administrative controls for medium exposure risk workers are to keep customers informed about symptoms of the coronavirus and ask sick customers to minimize contact with workers until healthy again, such as by posting signs about coronavirus in stores where sick customers may visit, like a pharmacy, or including coronavirus information in automated messages sent when prescriptions are ready for pickup. Where appropriate, limit customers and the public's access to the worksite or restrict access to only certain workplace areas. Consider strategies to minimize face-to-face contact, drive-through windows, phone-based communication, telework. Communicate the availability of medical screening or other worker health resources. And to protect the workers in the high or very high exposure risk categories, the following should be implemented. Engineering controls should ensure that appropriate air handling systems are installed and maintained in healthcare facilities. You can see the guidelines for environmental infection control in healthcare facilities, and for more recommendations on air handling systems at the cdc.gov. CDC recommends that patients with known or suspected coronavirus, meaning person under investigation, should be placed in an airborne infection isolation room, if available. Use isolation rooms when available for performing aerosol-generating procedures on patients with known or suspected coronavirus. For post-mortem activities, use autopsy suites or other similar isolation facilities when performing aerosol-generating procedures on the bodies of people who are known to have or suspected of having coronavirus at the time of their death. And use special precautions associated with biosafety level 3 when handling specimens from known or suspected coronavirus patients. Administrative controls to protect workers in the high or very high exposure risk category. If working in a healthcare facility, follow existing guidelines and facility standards of practice for identifying and isolating infected individuals and for protecting workers. Develop and implement policies that reduce exposure, such as cohorting or grouping coronavirus patients when single rooms are not available. Post signs requesting patients and family members to immediately report symptoms of respiratory illness on arrival at the healthcare facility and use disposable face masks. Consider offering enhanced medical monitoring of workers during coronavirus outbreaks, provide all workers with job-specific education and training on preventing transmission of coronavirus, including initial and routine refresher training. Ensure that psychological and behavioral support is available to address employee stress. And what are the safe work practices to protect workers at the high or very high exposure risk category? Provide emergency responders and other essential personnel who may be exposed while working away from fixed facilities with alcohol-based hand rubs containing at least 60% alcohol for decontamination in the field. For more information on coronavirus in the workplace, contact your federal, state, and local government agencies. They are the best source of information in the event of an infectious disease outbreak, such as coronavirus. Staying informed about the latest developments and recommendations is critical, since specific guidance may change based upon evolving outbreak situations. Below are several recommended websites to access the most current and accurate information: the Occupational Safety and Health Administration, Center for Disease Control and Prevention, and the National Institute for Occupational Safety and Health. From all of us at LEMAX, we want to thank you for taking the time to learn more about how to protect your workers. You can contact us at any time at www.lemaxss.com. Call our office at 681-229-1457 or contact me personally, brian.anderson at lemaxss.com. Thank you and stay safe.